everyone, welcome back to another episode. If you are watching this on YouTube, go ahead and like and subscribe. And if you're listening to us on your favorite podcast platform, go ahead and follow us and leave a review. I read every single one of them, and it helps me keep going and creating content that is actually helpful for your CRNA school application journey. So today we're going to be talking about 3 things you should know before applying to CRNA school, especially considering how increasingly competitive it is. Hi everyone. For those of you who we haven't met before, I'm Sachi, a practicing CRNA, and I provide educational content and resources and helpful tools to support you on your journey to CRNA school acceptance. So today we're going to talk about the 3 things to know before applying to CRNA school. Number 1 is understanding the CRNA role versus other advanced practice nurses. Now, this is crucial because going to school for 3 years and taking on significant debt should not be taken lightly. You need to be confident that the CRNA profession is the right fit for you. So how does the CRNA profession differ from, say, a nurse practitioner? For one, CRNAs focus on one patient at a time. Nurse practitioners and other primary care clinicians often manage multiple patients simultaneously. If you work in the hospital, you're typically rounding on a bunch of patients, or you do clinic, you're seeing a bunch of patients in one day. It's a lot. But CRNAs, you typically do anywhere from 1 to 2 to 3 to maybe 4 cases a day. It's not the volume that other nurse specialties see. CRNAs are also skilled in various areas. We heavily focus on bedside care. We're still right there with the patient, right at the bedside, performing procedures like inserting central lines, arterial lines, and intubations, even doing nerve blocks. It's still very much of that bedside care element. Another key difference is that CRNAs can practice independently in many states. These are known as opt-out states. And if you've been around here for a minute, you've heard me talk about this a lot before and why it's so important. But essentially, an opt-out state means that if you live in a state that's an opt-out state, it means that CRNAs don't require, physician or anesthesiologist supervision. This is important to consider because you might be working independently as a CRNA somewhere, perhaps in a rural or critical access hospital where CRNAs are crucial to providing this access to care. You could be the sole anesthesia provider. The role of the CRNA is so unique, and it really requires a bit of understanding before applying, not only because programs are expensive and the school is long, but it is a very unique role that as ICU nurses, we don't often get exposed to as much because CRNAs are like in the OR, you don't get to observe exactly what they do. And that is why schools have a shadowing requirement. And the more hours that you shadow, the better. And you can really get a deeper understanding of the CRNA role, and what is going to drive you forward in school is going to be those experiences in your shadow hours where you remember all of the cool things that you saw and observed, and you can look back on and reflect on and say, yes, I know for a fact that this profession is for me. I want to keep moving forward. The other thing you want to really keep in mind is, yes, back in the day, you could apply with just 8 hours of shadow experience. That, yes, it may be the case in some programs, but a lot of people are getting more than 8 hours of shadow experience. I really encourage you to aim for at least 24. I'm seeing applicants getting closer and closer to 40 plus shadow experiences. Now, you might be stressed out hearing me say that and say, wait a minute, I'm having such a hard time finding CRNAs to shadow. The first thing I'm going to ask you is, have you gone to a state meeting or even a national meeting? Because there are going to be CRNAs there who want to help you and will offer to give you shadow experience. All right, so number 2, the thing you need to know before applying to CRNA school is the political climate surrounding CRNAs. Now, I mentioned this before, CRNAs can practice independently. In some states, these are opt-out states. Now, there is a push within the CRNA profession to increase the number of opt-out states. This is one of the things that we really advocate for. Now, I'm not going to dive deep into the political aspects today on this episode. It's a little bit of a nuanced discussion. You kind of just need to be familiar with the fact that this is one of the things that we are advocating for, but it is a big part of what it means to be a CRNA once you graduate from school. That's something that I wasn't aware of until I got into CRNA school, and I wish I knew a little bit more about this political climate beforehand. But attending AANA meetings can teach you more about this. You might even be asked, to be honest, about the political climate in your essay or your interview. It might be something that you can touch on to show that you have insight into these hot topics that we face as CRNAs. So it's really wise of you to educate yourself. Our accelerator students, we talk about this a lot in detail, but you have free access to this information as well. The AANA website has plenty of free information about opt-out states. All right, number 3, you need to know about the role of CRNAs in the broader healthcare system. By understanding the importance for opt-out states and advocating for that status, by allowing CRNAs to practice independently, you're going to start to connect the dots to see how this impacts the financial health of our healthcare system. When CRNAs can practice independently without requiring physician, anesthesiologist supervision, the cost of providing anesthetic care goes down. It can be reduced, right? More anesthesia providers become available to deliver anesthesia care if you have CRNAs and anesthesiologists sitting in rooms providing an anesthetic. So studies show that having an anesthesiologist supervise CRNAs is just a more expensive healthcare model. We all know that America's cost of healthcare is an issue. So in addition to that, the cost aspect, we have critical access hospitals closing because they do not have enough anesthesia providers. And even veterans are waiting for care because of a shortage in anesthesia providers. So the CRNA profession overall plays such a unique and valuable role in lowering anesthesia costs and increasing access to care, especially in rural areas. You can find out all this information online by doing some research, and being able to discuss these nuances in your essay and your interview can be very powerful. State and national meetings can teach you more about these aspects, and I highly encourage you to attend. And our accelerator program dives deeper into that political side as well. We're welcoming a new cohort at the end of April, so stay tuned for more of that information. But to recap, the 3 things you need to know before applying are: number 1, how the role of the CRNA differs from other advanced practice nurses, and a little bit about the political climate for CRNAs, and the role the CRNA profession plays in our healthcare system at a higher level. So these are the things you're going to want to mention in your essay and be prepared to discuss in your interview.